two, one. You are live.
Yes, and we're going live. All right, hello everybody. It's Dr. Alex Earl, and it's Hump Day with Dr. Alex Earl. We're here at Pure Plastic Surgery today, and Hump Day is when I get to spend the time with you guys and go over all the different plastic surgery topics. And you know what I was reading last night? So last night I was reading one of the surgeries that we do that's becoming more and more popular. Basically, the one that's growing the fastest right now is the breast lift. So I was reading an article yesterday, and I was talking about how now women they are either opting for not having a breast implant or for going for a smaller implant, but then also opting for doing the lift. So this surgery is becoming more and more popular. So I wanted to kind of get into that today. I'm going to talk to you about the breast lift, the different kinds of breast lift, the different scar patterns, and who's like a good candidate for each. And then of course, we always got to talk about the good side, but we also always have to talk about the potential complications. So we're going to talk about that towards the end as well, okay? And then once we're done, of course, I'm happy to answer any questions that you may have, whether it's about the breast lift or any of the procedures that we do here at Pure Plastic Surgery, all right? All right, awesome. Okay, so what is a breast lift? Well, it is exactly what the word means, right? We're lifting the breast. A breast lift can be done on its own, or it can be done as a reduction. So all breast reductions also have a lift component to them, okay? And the scar patterns are all very, very similar. And a breast lift can be done with or without an implant, okay? So those are all like the different combinations that you do, all right? But there are multiple different types of breast lift, okay? And that's why sometimes it can get a little bit confusing. And the type of breast lift really depends on how droopy the breast is, okay? So what is the technical term for breast droopiness? The technical term is called ptosis, okay? So ptosis is a technical term, and there's different degrees or different grades of ptosis, all right? And how do we do that? Well, it all depends on the relation of the nipple to the inframammary fold. So what is the inframammary fold? That's the fold, that's that breast crease underneath the breast, where basically the definition between the breast and the chest, okay? So the relationship of the nipple to the inframammary fold is going to determine the degree of breast ptosis or droopiness that you have, okay? So when the nipple position is above the inframammary fold, okay, then you don't have any ptosis, so it's zero. That's a zero ptosis. That means that the breast is not droopy at all. The breast is, and the nipple position is kind of where it's supposed to be, above that inframammary fold, okay? So as long as it's above the inframammary fold, we say that there is no droopiness or no ptosis, okay? Then you move on, so when that nipple position then is at the level of the inframammary fold, so it's basically at that level but not below it, then you have a grade 1 ptosis. Grade 1 ptosis, okay? If that nipple position then falls below the inframammary fold, so now it's lower than the fold, but it's not the lowest point of the breast, okay, then that's a grade 2 ptosis. That's grade 2 ptosis there. All right, and then the most severe type of ptosis is when the nipple position is certainly below the inframammary fold and it is the lowest point of the breast, basically breast pointing down. So when you have breast pointing down, that is a grade 3 ptosis, which is the most severe type of ptosis that you can have. All right, so these are the different gradings. You have 0, 1, 2, and 3. And like I said, it all has to do with where that nipple is positioned in relation to the inframammary fold. Why is this important? Because it comes into play in terms of what type of procedure that you can get and what type of lift you should get, okay? Now, of course, every surgeon is going to be a little bit different. They may have a little bit of different criteria, but I'm just going to give you like the general information, okay? So when you have no ptosis, so no droopiness, then there's no need for a breast lift. So you don't need a breast lift at all. And if you're gonna do anything, then you can do a breast augmentation. You can do basically straight implant without a lift, okay? Now, if you have a grade 1 ptosis where the nipple position is a little bit lower at the level of the IMF but not below it, then sometimes you can get away actually with no lift if you choose to put in a larger implant, because you can get some degree of lift with an implant. But other times, the most common one that we might do here is what we call the donut lift, or the circumareolar lift. It's the one where it goes just all around the areola in a 360-degree fashion. There may be some patients where you might also need to do a little bit of a vertical lift with that, but it's not so common. Now, as you get into more droopiness, now you're in that second degree ptosis, meaning now that the nipple position is below the inframammary fold, not the lowest point in the breast, but below the inframammary fold. Well, then you're going to need a more aggressive lift. And for these, we typically are going to be doing a vertical type of lift, or a lollipop. You may have heard the name of a lollipop lift, or lollipop type pattern, okay? So that's the most common for the second degree ptosis. And then when you have the most severe amount of ptosis, or when you have a large breast that requires quite a bit of reduction, then that's when we're going to employ what we call the anchor type pattern, or the technical name for it's called the WISE pattern. So the WISE pattern, or anchor type pattern of a lift. Now, what are these patterns referring to? They're referring to the scar pattern, what things are going to look like on the outside, okay? So of course, if you're doing just a straight breast augmentation, no lift, then the only scar that you have is the small little tiny incision that we're using to place the implant, which is typically in that inframammary fold, no bigger than say 3 to 4 centimeters, okay? Remember, a surgeon is judged by the size of their scar, and the smaller the scar for the breast aug, the better and more experience the surgeon has. So for us here, I can typically put in a breast augmentation, put in an implant in a tiny 3 centimeter incision. Okay? Now, if you're getting into that grade 1 ptosis and you're going to do that donut pattern, that means that the scar is going to go all the way around. So this is your nipple. The scar is going to go all the way around the areola. So all the way around in a 360-degree fashion. If you're going for that vertical or lollipop type pattern, then you have this one, right, all the way around the areola, and you also have one that comes down from the areola towards the bottom of the breast. That's basically the stick of the lollipop, and that's why it's called vertical, because of this vertical incision that you're adding down here. And then if you have the most severe type of breast droopiness or breast ptosis, then you're going to require that anchor or WISE pattern, where you have the one that goes all the way around the areola, okay? You also still have that vertical one that goes all the way down, but now we're adding a horizontal one that goes along that inframammary fold, okay? And that's the type of lift that we use for grade 3 ptosis, or for a lot of our breast reductions as well. All right, so those are the different scar patterns. So it's not really about like what you want, right? If you're coming to me and you have grade 3 ptosis and you're like, Dr. Earl, I want a donut pattern, I'm just gonna tell you, I'm sorry, you don't qualify for that. You're not a candidate, okay? So it's not really about just like, what is it, Burger King, have it your way, right? It's about who qualifies for which particular type of lift, okay? All right, so those are the different scar patterns. Now what we do on the inside with the tissue depends on the patient, right? So if the patient wants to reduce the breast, then we're going to be removing more breast tissue. If the patient wants to just do a lift and not lose a lot of volume, then we're going to be keeping as much of that volume as possible. The other thing that we can do is that we can kind of rearrange the tissues a bit so that we can then give you more fullness in that upper pole of the breast, okay? So sometimes we can do that without using an implant if you have enough of your own breast tissue that I can then rearrange it and push it more towards the top of the breast and give you more fullness in that upper pole of the breast, okay? Once again, not everyone qualifies for this. Say, for example, you are a massive weight loss patient, okay? And you lost 100 pounds. Well, in a lot of our massive weight loss patients, they end up with a grade 3 ptosis because their breasts completely deflate, and so the nipple position falls way down. But the other problem is that they lose a lot of volume in the breast as well. Sometimes we call it like the empty breast syndrome, okay? So if you don't have any volume in the breast and you have this very droopy breast, then the best thing to do is to combine an anchor type pattern breast lift with an implant, because the breast lift will lift up that nipple position and the implant will restore the volume, okay? So that's why sometimes we can combine these things. Every patient is a little bit different. Every breast is a little bit different, okay? There's many considerations to take. So that's why we gotta, analyze each individual patient and then come up with the best plan, that is unique for that patient, okay? So a lot of variables will come into play, like what's the different breast lift that we're gonna use? How much of your own tissue are we gonna keep? Are you gonna use an implant? What type of profile of the implant? How much volume to the implant, right? So it can be quite complex. So, that's why I went to school for 17 years and then have practiced for another 10 years to get to this point, right? So it's not a simple decision. Like I said, it's not you just look at someone and say, I want to do this and that's it. All right, there's a lot of factors that come into play. All right, so what are some of the potential downsides? Well, let's start with the most common. So the most common is, especially when you're looking at the vertical and the anchors, that there may be some loss of sensation to the nipple area, especially with the anchor pattern. So with an anchor pattern, having a loss of sensation to the nipple area is actually quite common. Now, how much sensation you're going to lose, that's going to depend on the patient. It varies a lot from patient to patient. And the other thing I'll tell you is that it's worse at the beginning and it can get better over the course of the first year after the procedure, but it may not come back to normal, okay? That's something that needs to be accepted, all right? You may lose some sensation and may not come back to completely normal. The other one that's actually quite common, we're going to skip down to this one, is wound breakdown, the wound opening up. And so again, for the anchor, for the vertical, it may happen here where these two scars meet. And for the anchor, it may happen here and here. Basically the areas where the scars meet, okay? Let me put that in black so it's easier to see. So here, here, and here. All right, we call this the triple point. And so sometimes you can get wound breakdown or opening of the wound in that triple point area. It's usually not a big deal. Typically we just treat it with some antibiotic ointments and dressing changes and it heals on its own, okay? But is that something that I make sure that all of my patients are aware of? Because if it does happen, I don't want anyone to freak out, okay? Don't get scared. It can happen, and we'll just treat it with those antibiotic ointments, a little bit of dressing changes, and eventually it'll just seal up, okay? Now, infection, like any surgery, right? There's always going to be a risk of infection. With this surgery, it's quite low, in the maybe 1 to 2%, okay? But it's not zero. Remember, the only way to have a 0% complication rate is to not do surgery at all, okay? Just in the same way, like the only way to have a 0% chance of crashing your car is to never drive, right? Makes sense, okay? So, hematoma, bleeding, also possibility, pretty rare. I would say less than 1%, okay? And then this one is rare. This one is super important. And it's rare if you go to the right surgeon who has a lot of experience, okay? So I've been doing surgery for over 10 years now, okay? And I've had, in 10 years, thousands of surgeries. I've had 2 incidents of this, okay? And the last one was a few years ago. I don't remember exactly how long ago it was. All right? But you want to go to a surgeon who does quite a bit of these procedures to prevent what is the most potentially catastrophic complication of all this, which is nipple necrosis. Necrosis stands for death. So I'm quite literally talking about nipple death. When the nipple turns black and falls off. No bueno. Bad thing. Okay? So you definitely want to avoid that. Surgeons with a lot of experience have an extremely low rate of nipple necrosis. But like I said, like everything in medicine, everything in surgery is not going to be 0. But you want that to be much less than 1%. Much less than 1%. Okay? So yeah, this is not good. If that were to happen to you, typically we have to then treat the wound with bandages, dressing changes. Eventually the wound heals up, it becomes a scar, and then we have to rebuild or recreate the areola and the nipple in the same way that we do for our breast cancer patients after they get their mastectomies for breast cancer. Okay? All right. Okay, questions?
Okay, let's start, Doc.
Let's do it.
Well, how many surgeries do you perform a day? Daily?
So, yes. So now I don't operate Monday, so I operate Tuesday through Friday. And the most that I do in one day would be 5 surgeries. And it could be a mix. Certainly they're not all going to be the same thing. Typically I'll have a couple BBLs, maybe a breast surgery, a tummy tuck, or a mommy makeover. But I do limit myself to 5, even though I'm booked out all the way through March. Because each surgeon needs to know their limits, okay? I want to be able to put as much effort into my first surgery of the day. I want to be able to put in as much effort in my last surgery of the day as I do in my first surgery of the day. And that's why I limit myself to that number.
Okie dokie. Can a valley be combined with a tummy tuck?
Yeah, definitely. So a belly is something, so what is a belly? For those of us that are watching and I'm not sure. So a belly is a new device that we're using for cellulite. It actually works really well. It's like pretty much the first, modality to treat cellulite that actually works. And 90% of women, or 9 out of 10 women, have cellulite. So we're super excited about this. We've been using it for the past few months. The patients are extremely happy. And you can combine it with other surgeries. So you can combine it with your tummy tucks, your breast surgery, your mommy makeover, pretty much any surgery. The only surgery where we have to be a little bit more careful is the BBL, where we're actually, doing quite a bit of fat transfer to the buttock. And sometimes it's tough to do a lot of fat transfer and do the belly at the same time. For those procedures, sometimes we have to spread them out.
Okay, this is for many questions that are like general.
Yeah.
How they book the consultation, because they need to be checked.
Yeah. So like I was saying before, yeah. So when we're talking about this, it's actually fairly complex. There's a lot of factors that go into it. So the best thing to do is to get an evaluation. So the best way to get an evaluation, or the easiest and most straightforward way to do that, is to go to our website. Okay. So you're gonna go to www.pureplasticsurgery.com. Okay. And once you get into the landing page, you're gonna see a button. We call it a button, but a place that you can click where it says virtual consult. Virtual consult or virtual consultation, okay? You're gonna hit that button. It's gonna take you to a page where you're gonna be able to fill out a questionnaire, and you're gonna be able to submit and upload photos. You're gonna need at least, for breast surgery, we're gonna need at least 3 photos. So front, side, and side, okay? And that way we'll be able to do the evaluation and come up with a plan for the best procedure for you.
When can we have a mommy makeover after a baby?
So you're gonna wanna wait absolute minimum of 6 months, okay? But listen to this, because there's a caveat there. If you're breastfeeding, you need to wait at least 6 months after you stop breastfeeding, okay, to do the breast portion of the mommy makeover, okay? So if you don't breastfeed at all, then it's going to be 6 months from giving birth. However, if you do breastfeed, then that's going to get expanded, right? Because it's going to be 6 months from when you stop breastfeeding.
When you have liposuction in the abdomen, does it tighten the skin?
Liposuction by itself does not tighten skin, okay? So if you have skin that's a little bit loose, or that's going to require some retraction or some tightening, then you're going to want to add a modality to the liposuction to help. So what are the possibilities there? The one that I think works really, really well, especially along the abdomen and the back, it's the Vaser, which we've been doing here for the past few months. And I highly, highly recommend it. You get better skin retraction. The fat comes out easier, so there's less blood loss and less inflammation. So I highly recommend the use of the Vaser. And then other modalities that you can add are Body Tight, which also helps with skin retraction. J plasma, or Morpheus. Okay, and in some patients we may be doing all three. We may be doing Vaser, Body Tight, and Morpheus, all of those modalities at the same, in the same setting to try to help the skin retract as best as possible. Now, again, you have to be a good candidate, right? If you have a lot of loose skin because maybe you had multiple pregnancies or massive weight loss, then you just may need a tummy tuck, right? So if the skin is quite excessively loose, then probably the best procedure to start with might be a tummy tuck.
Is it common to have boxy-shaped breasts after anchor lift? What can help?
Okay, great.
Second round?
That's actually a great question. So when you first have your lift, especially when we're talking about the anchor type lift, right? So for a breast lift or a breast reduction with an anchor type pattern, at the very beginning, I would say within the first 3 months, it is going to look a little bit more kind of boxy at the bottom, okay? It's going to look a little bit more boxy at the bottom because we've really kind of tightened it up because we're expecting that to expand. And then also sometimes that vertical scar in the middle can be a little bit tight initially. But what's going to happen is that over the course of the first anywhere from 3 to 6 months, this scar is, that vertical scar is going to loosen up. Okay, and the skin's going to stretch out and it's going to round out the bottom of the breast. And this is a process that just happens kind of naturally on its own. We just have to give it time. Minimum 3 months, sometimes up to 6 months.
Here's a good one, Doc.
All right.
Should you do your lift prior to lipo or tummy tuck?
So you don't necessarily have to. You don't necessarily have to do it before lipo. It can be done after lipo, but a very common combination is to combine your breast lift with your tummy tuck. And that's what we typically call a mommy makeover. So those you can combine, and that can just be one surgery. Along with that, we'll do some lipo, but not, we're limited here in Florida. We can only take out 1 liter. So typically we focus the lipo to the thighs and the waist, okay? But then if you're also going to want a lipo 360, then I recommend coming back 3 to 4 months after your mommy makeover for your lipo 360 and or BBL.
Breast lifts are under general?
Yes. So definitely any of these procedures are under general.
Ok. ¿En español?
Seguro. Vamos a darle.
¿Qué tanto se logra eliminar la fibrosis en pacientes con una nueva liposucción?
Bueno, lo importante es tratar de prevenir la fibrosis. O sea que si notas que estás teniendo un poquito de fibrosis dentro del primer año después de la cirugía, después de la lipo, hay modalidades que podemos usar para disminuir ese riesgo, como el masaje, la cavitación, radiofrecuencia, ultrasonido, ¿okay? Y el uso de instrumentos de madera, lo que decimos wood therapy, ¿okay? Ahora, si ya ha pasado más de 1 año, bueno, ahí sí hay que volver y tratar de hacerlo de una manera quirúrgica. Y lo que recomiendo es, entonces, en ese instante es usar el Vaser, porque el Vaser va a poder ayudar a romper esa fibrosis y como que empezar de nuevo.
Thank you, Doc. Yeah. How long are we under general anesthesia for a BBL?
So that's going to depend on the patient, really, and then how much we're doing, how many add-ons there are. So on the low range, say you're a lower BMI patient, say you're a BMI 22, and we're doing just a straight BBL, nothing else, it could be actually quite short. It can be 1.5 hours, right? On the other side, say you're a patient higher BMI, your BMI is 29, and we decided to say add liposuction to the arms and Vaser and body tight to the inner thighs and face tight to the chin, right? So on the flip side, then it can take up to 3 hours, okay? So it's going to be a big range. It's going to depend on your BMI, how extensive the surgery is, how many add-ons we're gonna do. So it's going to range, depending on each individual patient.
What would be the ideal way to get the BBL or the South Beach butt lift?
So for the South Beach butt lift, that's our signature kind of skinny BBL that we do here at Pure Plastic Surgery, and it is for the lower, a little bit lower BMI patients. So ideally, you're going to have a BMI between 20 and 24 to qualify for that procedure.
Can I do a mommy makeover with a BBL?
So I don't combine those procedures, okay? First of all, I mean, there's multiple reasons. Combining a mind makeover with a BBL is a very big surgery. It could potentially take several hours in general anesthesia, much more than 3 hours. That means that all the complication rates are going to go way up. The possibility of blood loss goes way up. The possibility of needing a blood transfusion goes up. Possibility of infection goes up. And the possibility, which is a dangerous one, of blood clots. Okay, DVTs and PEs, blood clots in the legs, blood clots in the lungs, goes significantly up. Okay, so it's just too risky. I do not recommend that combination. Another reason is that here in Florida, when we do something like a tummy tuck or a mommy makeover, we're limited to removing only 1,000 cc's of fat via liposuction, which is not a ton of fat to remove and usually not enough for then the fat transfer for an adequate BBL fat transfer to the buttock and hips. So you're going to be compromising your surgery because you're not going to get enough fat. You're not going to get the best out of your BBL. You're not going to get the best out of your mommy makeover. Your recovery is going to be extremely tough because you have to be on your back, but you have to use like a special mattress or special chair to try to relieve the pressure from the buttock or the hip area. Okay, so now you're compromising either the tummy or the fat transfer, and your complication rates are going to go up. It's just not a good idea.
Can you do a breast lift with fat grafting to the breast?
So you can't really lift a breast that way, okay? So all that fat grafting does for the breast is give it more volume. And it's one of the reasons why I don't do it. It's not that popular of a procedure because it doesn't work the same as an implant, and it definitely doesn't do what a lift does, okay? Basically, when you're doing fat transfer to the breast, first of all, you're very limited as to how much fat you can.
Okay, Doug, and what's the lowest BMI you have done? I guess for a BBL.
Any surgery?
For a BBL.
For BBL, typically the lowest is going to be 20. That's about as low as we can go. And even for those patients, sometimes with a BMI of 20, I mean, I really have to kind of dig in there to try to get as much fat as possible. Once you get below 20, it's very, very tough to find enough fat to do an appropriate or BBL that's going to make a difference. All right. Okay. Awesome. This is great questions. So I hope everybody learned about the breast lift. It's a surgery that's growing more and more. I think it grew something like 30% this year, maybe another 30% last year. So there's a lot more interest in this procedure. So now you know pretty much everything you got to know. But remember, you need an evaluation. So make sure you go to that virtual consult, send in your information, send in your photos, and I'll let you know what's the best procedure for you. All right? Well, I look forward to seeing everyone next week on Hump Day with Dr. Alex Earl. I'll see you then. Ciao.
We're ready.